everybody. Welcome back to another episode of Honestly Bilal. I'm your host, Bilal Ahmed. I'm a fourth-year medical student at the University of Toledo, and this is Honestly Bilal, the show for the aspiring ophthalmologist. I talk to medical students who are interested in ophthalmology. I talk to residents training in ophthalmology, and sometimes, if I'm lucky, I'm joined by current ophthalmologists in the field. Today, my guest is Dr. Andrew Hendershot. Dr. Hendershot is an associate professor of ophthalmology at the Ohio State University, where he is also the program director for the ophthalmology residency program at Ohio State. Dr. Hendershot has been named one of the top 10% of physicians in the nation for patient satisfaction from 2015 to 2019. He's been named one of America's best doctors in 2017, and he's presented numerous educational lectures at national and international conferences. And finally, Dr. Hendershot has been part of collaborative research with multiple cancer drugs trials at the Ohio State University. Dr. Hendershot did his medical school, residency, and fellowship at Ohio State, so he's a true Buckeye. And Dr. Hendershot, it's a pleasure to have you, so thanks for joining me.
Yeah, thanks, Paul. It's a pleasure to be here. Appreciate you having me on.
Absolutely. So for those who don't know, actually the way me and Dr. Hendershot got connected was kind of interesting. We both partook in the virtual mentorship program started by Dr. Andrea Tooley, Dr. Usiwoma Abugo, and Dr. Janice Law. So part of that initiative kind of led us to where we are today. So he's my virtual mentor and I'm his mentee. So here we are.
And I appreciate the irony that I'm on your show and I am your mentor. So.
Yeah, right. I know it's kind of. Hopefully, it still works out. So I appreciate picking your brain today. So it should be fun.
No problem.
So kind of take us back from the very beginning. You know, like what drew you to ophthalmology, and then even from there, what drew you to cornea?
Yeah, I mean, I've got a fairly traditional story with a non-traditional twist. So growing up, my father was actually an ophthalmologist. I grew up in a small town in Ohio. And that's just kind of what I saw as what a doctor was. You know, I mean, I can remember being a kid. And we would go Christmas shopping for my mom, and my dad would take us, and we go to like the mall, in a small town.
Right.
And like everybody we ran into over the age of like 60 was like, "Oh, hey, your dad did this, that," and so for me that was just kind of like what being a doctor sort of was.
Sure.
And then so that was kind of my plan. I mean, as early as I can remember, not saying like race car driver or fire truck.
Right. Yeah. Sure.
Something. It was just kind of like, yeah, I mean, I'm going to be a doctor, I guess. It was my dad's dad was actually a general practitioner and then an anesthesiologist. And, I've got nurses and doctors kind of on both sides of my family.
Okay.
So the medicine was kind of a foregone conclusion, more or less, maybe when I went to college. Mm-hmm. I knew I was going to do pre-med, and I did kind of biochemistry pre-med, sight set on medical school. Gotcha. OSU kind of always being kind of my personal goal, I guess. I looked at a bunch of other schools, in the end, it was kind of down to Vanderbilt and OSU. And in the end, like you said, I mean, I'm a true Buckeye. I was actually, even though we lived in Illinois at the time, born at OSU. So a lot of my kids have now been born at OSU. So for me, it was just kind of, what I had always envisioned.
Sure.
And then, I mean, I kind of went in thinking ophthalmology. I was in the ophthalmology interest group. And partway through maybe third year, I don't know. It didn't have like the sparkle. Maybe I don't know. I mean, obviously I was wrong, right? But for me, for part of it, I just didn't. It wasn't doing it for me in school. And I don't know if it's the shadowing experiences that people have sometimes are very passive. I would just kind of stand in the corner and then look at something and not see anything. And I was like,
right.
And then. On the flip side of that, you go to the trauma bay and we're doing stuff. And I was like stitching up laparoscopy ports. And so I actually went into general surgery, I, as a fourth year, applied to general surgery and then stayed at OSU for my internship. Wow. And then once reality of kind of what gen surg was set in, I guess, once I started looking further down the road, which is usually my advice for early medical students, don't look at the residency, which is what I had done. I had looked at the residents that were at OSU, the surgery residents, like these guys and gals are cool. I want to hang out with these people. I want to be them. I want to do what they're doing. And then by the time you get there, all those people are gone, right?
That's true.
And I was looking at the attendings coming in with their kids, like on rounds. And I was just like, I don't know, man. The hospital,
that's true. Right.
People come in with like hernias and they have belly pain and you operate on them and they have belly pain. And it just, so it took me about 4 months to realize it was a bad decision. So I was left with kind of some potential time on my hands.
Okay.
because I had already missed that application cycle. So I had the application for business school actually on my desk. I
Wow.
was looking at pre-residency fellowships. I was looking at maybe just working at the Department of Ophthalmology at OSU. They
Hmm.
had talked about hiring me to do like H&Ps and, kind of some of that kind of just grunt work sort of stuff.
Huh.
And then a person who had matched OSU ophthalmology from my med school class actually during
Hmm.
her internship had a change of heart and switched from ophthalmology to anesthesia.
I
So
see.
OSU had interviews more or less for that position, and I interviewed with the then program director like between his surgery cases because we were both at the hospital all the time.
Right.
And yeah, so I was super fortunate. But certainly, when people ask about what to do with years, I was kind of didn't end up having to do any of those things, but was kind of looking down that path.
Mm.
Um, and then, ophthalmology residency, I was surprised. Once I had made that switch, it was October, November. By the time we had all that ironed out,
Sure.
I knew I was going to be an ophthalmology resident. I was just going to complete my internship. And I can remember being on night float as a surgery resident, and I want to say it was in February, and seeing the ophthalmology residents all the time in the ER. I mean, we go to a
Oh,
trauma and
wow.
be like, wait a second, like, what are you, like, why are you into ophthalmology being kind of a lot of work? And really realizing how much time it was going to spend. As a surgery resident, I was in the hospital, from 5 a.m. until 7 p.m. or whatever, and I would just come
Sure.
home and
Sure.
sleep and do it all again. But in ophthalmology, I was still there from a little before 7 until 5 or 6, and then I was doing research projects and reading. I mean, you have to go to medical school for the eye in residency. I mean,
Right.
you get a
Right.
lecture
Right.
or two if you're lucky. And so I
Yeah.
was really surprised at the work
Hmm.
in terms of, I thought I was just going to be like, oh, ophthalmology would be real easy. But you're
Sure. Sure.
also,
Sure.
taking the in-service against people who, well outscored me on steps and that kind of stuff.
Hmm.
And then in terms of fellowship, I mean, it came down to kind of what at that time I was now married and my wife was in medicine. We were trying to sync up training and things like that and where we were going to go.
Sure.
And the program at OSU did not take a fellow because we were switching to EMR, we were moving locations, and it was like our chair and division director were the fellowship people, and they're like, look, we just don't have time. And
Mm.
so by the time my wife and I figured out what we wanted to do, it was like already, December, January. And I was just like, well, can I, be a fellow and stick around? I realized
Uh-huh.
it's going to be tumultuous, but it worked out really well. And then partway through my
Right.
fellowship, my fellowship director at the time was our chair. Was kind of looking to expand, and at some point we had talked about how much my wife and I love Columbus, and they
Mm.
were kind of offered me a position to stay on if I was willing to go to the VAs and help out and help that kind of
Sure.
stuff.
Sure. That's
Yeah,
crazy. So it sounds like a little bit of you had to question yourself and doubt a little bit and really find your own path. And I feel like I think that's something a lot of us resonate with because it's normal to ask questions and be like, is this right for me or am I good enough? And
mm-hmm.
I guess like you persisted and you found a way to make it work. And now you're program director for Ohio State.
Yeah.
So kind of talk to us about the challenges of being a program director and then also the rewards and something that you really find gratifying about it.
Yeah, I mean the challenges I think often come in kind of the balance of priorities. So I mean
Hmm.
there's kind of a lot of hats. So I mentor all the residents. I advise all the residents. It's
Sure.
literally my job to make sure that people succeed at this. But I'm also the
Yeah.
person when they're not succeeding that has to, come up with, plans to get them back up to speed. I'm the one who
Sure.
has to harass them about deadlines and things like that. So the
Right.
challenges for me are when, maybe people don't understand the weight of some of the things that they're doing or not doing. And
Hmm.
it is often kind of what would probably classify under professionalism kind of stuff. So people are
Sure.
showing up late to lectures, or people aren't, when they're doing grand rounds, they're not, meeting enough as the faculty wants them to meet and that kind of stuff. So,
Hmm.
and I think, as a resident, you have a lot of stuff on your plate, and it's easy to kind of say, well, in medical school, you're kind of on your own and you're on this path and you get it done,
Right.
done.
Sure.
But it can be seen differently from other people, when if
Mm.
more than a couple residents are late to a lecture, you know, it's like the program director, I get a pop in or an email like, did
Yeah.
you know that, you know, so
Right.
that
Yeah.
can be kind of the challenging parts. And then dealing with, you know, changes. I mean, you know, we could spend podcast over podcast talking about COVID changes, but I mean, even before that,
Yeah.
just switches in ACGME or changes in faculty positions
Mm-hmm.
or sites. You know, we have 2 different VAs, and at one point, you know, every year or two, it seems like one of them, like the ORs are under construction, and so like the
Mm-hmm.
residents can't operate there, you know, at normal capacity for 3 or 4 months, and you're just kind of like trying to juggle a lot of things to even out training. Um,
Sure.
so I'm very lucky to have a lot of really good help at OSU. You know, we have a program manager and a program coordinator. We've had great chairs, you know, throughout my time there. So that's really, really helpful. I mean, the
Mm-hmm.
exciting part, the highs are, you know, watching people come in and do what they want, you know, they wanted to do. I mean, I can remember, you know, now the current third years were the first class that I was a program director for during interviews. And so I
Okay.
feel like,
Uh-huh.
you know, now this is like my 18 people, you know, plus now our
Right.
intern.
Mm-hmm.
And so I can remember, you know, interviewing this class distinctly and them saying, you know, this is my, you know, I want to go on a mission trip and, you know, I want to do this. And so watching them be able to do that is really, really cool.
Yeah.
And then seeing people do things that just haven't been done at OSU, for example, before. Having residents go to, you know, we had one of our recent graduates was the first person we ever had go to Women in Ophthalmology 2 or 3 years ago. And
Oh,
she
wow.
came back and was like, oh my gosh, like this conference is amazing, you know,
Uh-huh.
it's great networking. And so it was just like, oh, well, you know, and then, you know, she convinced 2 or 3 people to go with her the next year. And this year,
That's
well, I think
awesome.
we had 5 or 6 people accepted. It's, you know, virtual, but I mean, just to
Mm-hmm.
watch that kind of snowball. And
Yeah.
then the other thing that really is exciting to see as a program director is watching kind of residents mentor one another. We had a
Mm.
good, you know, recent first and third year, now second graduate and second year, who were just like, I had no clue. And, you know, the junior resident was like, man, this resident is like the most amazing mentor. Like she calls me
Oh,
all the
that's
time.
awesome.
This, and I was just like, I had
Yeah.
like no idea that, you
Never
know, that's
you didn't
going on.
see
And
coming.
it's just,
Yeah.
you know, you recruit these amazing people and then just to watch
Yeah.
them do like mind blowing things with their
Mm-hmm.
careers is, you know, I mean, that's just, you know, I like to be able to say, oh yeah, I helped train that person, you know, that's
Yeah.
pretty
Yeah.
cool.
Yeah. For sure. That's good. I mean, you could take some credit there. I think that's pretty fair. So I want to follow up on that actually a little bit because I wasn't thinking about this until now you brought it up. But you know, residents as teachers, right? So I guess that's a part of responsibility that you teach the people below you in training and then also medical students. So is that a part of the culture at OSU where, you know, that mentorship is kind of now been enforced a little bit more with the natural flow, obviously, but is it something that you look for in your residents?
Yeah, I mean, we definitely look for that in residents and fellows as well, people who are going to be good teachers. You know, just the way that a lot of the rotations go, you've got kind of junior and senior residents together at the VAs.
Mm-hmm.
And then even at children's, there's a couple second years and a first year. And then usually the VAs, there's kind of one or a bunch of people from different classes. And so there's a lot of kind of mentoring that takes place there. I
Sure.
mean, even down to, you know, we just wrapped up our, you know, orientation weeks with the new first years. And
Okay.
we, you know, there's some structure to that, but then it's the chief resident every year who kind of, you know, helps lay out that structure and makes changes. And then,
Mm.
you know, this year she is with them like those 2 weeks during their orientation. She's kind of off clinical duties and is with them, you
Wow.
know, teaching them slit lamps and gonio on each other and how to use
Gotcha.
tone pens and doing the tours. So it is kind of ingrained in the culture. The other thing that's maybe more accidental, but I think is really
Mm-hmm.
neat is one of our VA sites is about 50 miles away. It's like an hour car ride.
Huh.
And
Okay.
so in that, you know, the residents typically always carpool. And so you just, you know, when I was in this program, you know, as a first year, I was like, this is great. I got an hour to like pick the
Yeah.
brain second and third year, you know, if it
Yeah.
was about call last night or when I was a second year getting ready to do my first cases, you know, the whole way you're about to do your first case and you have a third year for an hour in the car being like, all right, let's just go
That's
through
very
this,
sweet.
you
Yeah.
know, step by
Yeah.
step. So when we started the, you know, the internship, that's where I wanted to put the interns for that reason, because I was
Mm.
like, man, if you were only going to do 3 months of ophthalmology in your intern year, you know, what if you had, you know, a first, second, and third year, you know, 2 years, I mean, not to yourself, but, you know, I mean, in the car ride, the whole time you can be talking ophthalmology, career guidance, just kind of laying out the structure of that. So
that's awesome.
Yeah.
That's very cool. Yeah, I feel like it's a great opportunity to kind of just get to know each other and kind of bond and stuff like that, I'm sure.
Yeah.
So, obviously this year, it's a crazy year. Application cycles are changed. Virtual interviews are happening. COVID-19 has affected everything from a medical education standpoint as well. So kind of talk to the applicants out there who may be listening about, what are some things or what are some challenges that you see you understand that they have. But what is your advice for them going forward with this interview season, application season, and stuff like that?
Yeah, I mean, I think the biggest challenges are going to be the away rotations and virtual, and visiting, because we've traditionally have taken, a person, I mean, I'm trying to think of the last several classes. There's at least 2 or 3 people currently in our residency program who did away rotations with us, and that's how we got to know them.
Sure.
And that opportunity is not nearly as good. I mean, we are doing virtual away rotations. We can't have nearly as many people doing that, and it's not quite the same, between patients to sit down with somebody and, get to know them. And in the OR, we have a student with us from Arkansas right now. And so when she's in my clinic, we have a iPhone that we carry around, and, I sit her down and we talk, and I show her, topos, and, we have a lane I can flip her into the slit lane, but it's, so I feel like I get to know her a little, but it's kind of like, this versus doing this in person. Right. So the aways are going to be kind of that, I think there's going to be some lost opportunities for research and things like that. I mean, I get emails from medical students who don't have home programs, or even some that do, like, can we do research there? Can we rotate there? And I mean, as a program director, having read applications for years and years and years, it's going to, we're all going to have to remind ourselves, like, okay, this is a different year. I know why this person didn't do any away rotations, because, they weren't allowed to travel.
Right.
So, I mean, finding opportunities where and when you can to make connections with people, if it's at, virtual meetings, if it's, working through alumni, that kind of stuff will be important to kind of try and develop relationships. And I think it's going to be real important. I mean, as we look at how recruiting season is going to be for us, it's going to be important for interviewees, current medical students to demonstrate that they have shown some investment into a program, right? So in a normal year, to come interview with us, depending on where you are, you got to, drive or fly, and,
right.
A lot of those barriers aren't going to be there. So it's not, you can be like, oh, OSU, yeah, sure, I'll interview there. But
right.
You need to know that you're interested in being there. And so I think it's going to be really important. I'm sure every program in the country is doing what we are. I mean, we're trying to generate content and videos so people can get a sense of what it's like to be at OSU. And live in Columbus and work at Ohio State. So taking the time to actually look through some of that and go through websites and get a sense of what a place is like, and being able to show that during an interview is going to show a place. I care enough about this, being here. I actually do want to be here, and I've taken some time to prove that. It wasn't just a click. I only got 18 interviews, or whatever. You can have up to 20. So I think that'll be really important this year. I think. The other advice, because there's going to be a lot of, like I said, you're not did X, Y, or Z to kind of innovate and try to make make my time worthwhile.
So, and then going from there for advice for applicants, as a program director yourself, what are some things that you look for when you sit down? I mean, you have hundreds of applications. I can't imagine how daunting it is to look at them, and I'm sure they're very highly qualified people as well. So what are things that stand out to you? What do you look for that you really want at your program at OSU, or something that you look for?
Yeah, I mean, I don't know how unique it is anymore, I guess, but I really like to see people's work history. My reason for that is I want to see people that can work hard, know what hard work looks like, and when they're faced with it, if they haven't been, I don't want people to have, a busy, challenging, residency be the hardest thing that's ever happened to them in their life. I want to know that they, come against some adversity at some point, or some kind of, event, and have come out successful. And that's usually what I talk about with people at interviews. So we're looking for that. I mean, I also like seeing people who I know can do, have at least been exposed to research and have an idea what that's like. We have required research at OSU, most programs do. just to know that, they can at least get some of that rolling. I mean, we have mentorship for that and, lectures for that, but it's just good to see some of that. And then big for us at kind of a bigger program is, teamwork. So knowing that you can get along with people, if it's, the 3 or 4 people that you're, at the remote VA for, and you're going to be in car rides, you can get along. Or at the VA in town here, there's usually 5 or 6 residents there at a time. They all got to kind of get along and work well together. So, I mean, that's what I try to tease out, from applications, is proof that someone, has faced some kind of adversity and conquered it and learned from it and can do it again, and has the support system and the tools in their toolbox to kind of get through all that. And at the same time, they can work with others and help others. I mean, it's give and take. When, you may be having a hard time and someone else is doing fine, and they can help you out, and vice versa. Because there is a lot of, support within a residency program. Many years ago when I was new to this, felt like morale kind of like people just weren't gelling, and I was like, you guys need to have like more get-togethers and more parties or this that. And the chief at the time sent me this like dated list by list, like these are the 12 functions we've had in the last 6 months where we all it was like they had a birthday party and they watched the Olympics together. And so I was just like, oh, okay. So it's not that, I mean, so because there's a lot of, we see that really well, and that's one of the things that I get excited about new classes start. Our first full class of interns, I remember our program coordinator and I were walking to meet them in like the conference room. They came during general orientation for like an afternoon with us. And Meredith's like, I got a good feeling about these people. And I was like, oh, she's like, they already got nicknames for each other. They already got a group chat together,
that's awesome.
A group text together. So, just knowing that they're kind of a cohesive, supportive group is, great. So if I can find people that are, work well with others, I guess, I mean, with the match, you can't pick, this is my class. You got to kind of say, looking for people that I feel like can work well in groups, diverse people coming from all over the place.
Right. I think on those VA car drives, someone's got to play the good music. So whoever's got the good music taste it's going to get along well with others there.
Yeah.
So, Dr. Hendershot, I just want to finish up here. Kind of tell us about, I mean, you talked about OSU a lot. Just give us your last little spill about, the culture at OSU, what you're excited about going forward that's happening at OSU, and just generally, what applicants should know about OSU.
Yeah, I mean, I think the biggest thing, the culture-wise, I mean, I've interviewed, at OSU, been an interviewer at OSU for 9 or 10 years at this point. And we always, have 2 attendings and 1 resident. So I learned a lot from the other people I interviewed with about kind of what was unique about OSU. Because, as you point out in your intro, I've never been anywhere else. But I mean, I think the things that really stand out to me are that the people that we tend to recruit and retain at OSU, faculty-wise, really want to be there to teach and are there for the residency program. And so that's just something that culture-wise, is amazing as a program director, and I hope is amazing as a resident here, that people are really dedicated to it. I can, if I say, I'm trying to think of the internship, or when we changed the lecture, the way lectures were organized, people are like, what do you, why? And I was like, well, this is a resident, the residents want this. Like, oh, okay. Well, I mean, if the residents want it, then fine. If it's just your, idea, maybe not. So just that dedication to the education and well-being of residents is amazing. I mean, the COVID thing is a prime example. I mean, I remember, my phone blew up some, day, and they're like, you need to call in now. Like, we're talking about, COVID changes, and everyone's top priority was like, how can we keep the residents safe? How can we protect them? How can we make sure they're staying well? We did Friday night happy hour Zooms, and people, one of our faculty members made like this elaborate, I mean, I'm sure, I realize the program is online, but all the questions or answers for Jeopardy, I mean, I can't imagine
it's fun. Yeah.
Into this. And I mean, we had like lists of people like, I want to be part of this. I want to be part of this. So that's,
That's cool.
that culture of, togetherness and working well to support each other, I think is one of the things that make us special. What I'm really excited about, we have a newer chair. So we had a new chair started in January, who's had quite the baptism by fire, as you can imagine.
Yeah, I bet,
Just, having a new person who's invigorating and, is bringing researchers with her and helping recruit clinician scientists, and just, is really kind of a go, innovate, let's make this better, you know, and let's use these kind of changes, a new chair, the COVID. I mean, we're all just like, this is a great excuse to do stuff we've always wanted to do, but don't have a reason. If it's changing rotations up, or, you know, flipping lectures more to flip classroom instead of traditional podium, you know, in a lecture hall kind of thing, like this is the time to do it. So I'm really excited to kind of start unleashing, you know, the faculty's creativity. And I'm really working on expanding the surgical curriculum this year, and we are working at, you know, really making our wet lab bigger and better. With new chair, you know, comes kind of some opportunities like that. So that's what I'm super excited about.
Yeah, and I think it's worth mentioning that your chair was formerly at U of M, so I'm sure it feels kind of good to recruit someone from U of M, get the W over them again. So
yeah. She
there's that too.
She did her MD PhD at OSU, so she's a Buckeye.
Okay.
You know, although
so
I think her kids
native.
are like straight U of M people. And
Oh,
so it's
no, see, that's gonna be tough. Well, that's funny. Dr. Hendershot, it's been a pleasure to have you. Thank you for joining me. I'm sure applicants are going to look forward to talking with you more, and we'll see how the year pans out. So good luck with everything at OSU, and we'll stay in touch.
Okay, will do. Thanks for having me. Good luck, everybody.
Thanks so much.
See you in interview season.
Alrighty.